The wound healing process consists of four overlapping but distinct phases. 1. Hemostasis, immediate response, occurs immediately after injury. Blood vessels constrict, vasoconstriction, to minimize blood loss. Platelets aggregate to form a clot, stabilizing the wound and releasing signals for the healing process. Fibrin matrix is formed, providing a scaffold for cells involved in subsequent phases. 2. Inflammatory phase, 0 to 3 days. White blood cells, primarily neutrophils, migrate to the site to clear debris and fight infection. Macrophages arrive later to engulf dead cells and pathogens and release growth factors, e.g., TGFB. Redness, swelling, heat, and pain are common as the body initiates repair. 3. Proliferative phase, 4 to 21 days. Fibroblasts proliferate and synthesize collagen to rebuild the extracellular matrix. Endothelial cells form new blood vessels, angiogenesis, improving oxygen and nutrient delivery. Keratinocytes migrate to the wound edges to reepithelialize the skin. Granulation tissue forms, filling the wound with new connective tissue. 4. Maturation remodeling phase, 21 days to 1 year or longer. Collagen is remodeled and cross-linked to increase tensile strength. Excess cells and blood vessels formed during the proliferative phase are removed. The scar tissue is formed, and it typically reaches about 70 to 80% of the original skin's tensile strength. Each phase is crucial for proper wound healing, and delays or disruptions in these phases can result in chronic wounds or complications. Wound healing is influenced by a variety of systemic and local factors that can enhance or delay the process. Here's a breakdown. Systemic factors. 1. Age. Older age slows healing due to reduced skin elasticity, impaired immune function, and slower cell regeneration. 2. Nutrition. Deficiencies in protein, vitamins, e.g. A, C, and minerals, e.g. zinc, iron, impair collagen synthesis and immune response. 3. Chronic diseases. Conditions like diabetes, peripheral vascular disease, and renal or hepatic dysfunction hinder wound healing by affecting blood flow and cellular functions. 4. Immunosuppression. Caused by diseases, e.g. HIV, cancer, or medications, e.g. corticosteroids, chemotherapy, it reduces the immune response critical for fighting infection and promoting healing. 5. Smoking. Nicotine reduces oxygen delivery and impairs fibroblast function, slowing wound healing. 6. Medications. Drugs like anticoagulants, corticosteroids, and NSAIDs can impair wound healing by affecting inflammation, coagulation, or cellular functions. 7. Systemic infections. Infections can redirect the body's resources away from wound healing. 8. Psychological stress. Stress and depression can suppress immune function and delay healing. 9. Obesity. Impairs healing due to reduced vascularization, increased inflammation, and risk of wound dehiscence. 1. Perfusion and oxygenation. Adequate blood supply and oxygen are essential for cell proliferation and tissue repair. 2. Infection and contamination. Infections delay healing by increasing inflammation, tissue destruction, and microbial competition for nutrients. 3. Moisture balance. A moist environment promotes epithelialization, but excessive moisture can lead to maceration. 4. Edema. Excessive swelling reduces blood flow and oxygen delivery, impairing healing. 5. Wound size and depth. Larger and deeper wounds take longer to heal and may require more resources. 6. Mechanical stress. Tension, pressure, or movement across a wound can disrupt granulation tissue and slow healing. 7. Foreign bodies in necrotic tissue. Presence of debris or dead tissue increases infection risk and hinders healing. 8. Wound temperature. Cooler wounds heal slower, as cellular and enzymatic processes are temperature sensitive. 9. Type of wound. Chronic wounds, e.g. pressure ulcers, venous ulcers, have impaired healing due to underlying pathologies. Summary. Effective management of both systemic and local factors is critical to optimizing wound healing. For example, addressing systemic nutrition or controlling infection at the wound site can significantly improve outcomes.